So good morning, I'm Catherine Cuellar. I'm Director of Communications for the City of Dallas, and I thank you for being with us today. We have Chief Dominique Artis and Chief Brett Stidham from Dallas Fire Rescue. We have Dallas Fire Rescue Medical Director, Dr. Marshall Isaacs, and we have City of Dallas Office of Emergency Management, Rocky Vaz, who looks like he's on a beach somewhere, but I'm gonna guess that's a virtual backdrop. I will take the calls or questions rather in the order that we received RSVPs, and we will be here till at least 11 o'clock. If others are able to stay longer, they are welcome to. So our first question will come from Dallas Morning News is Everton Bailey, and that will be followed by Laura Cruces from Univision. Everton Bailey from Dallas Morning News, take it away. Everton Bailey, I see that you're here. We're going to take you off mute.
Hey everyone, thank you very much for the time and the opportunity to chat. Really appreciate it. Everton Bailey from the Dallas Morning News. I was wondering, at this point, have you guys had a better understanding of when the vaccines are coming? Is it still going to be Christmas or Christmas Day? And are you guys still on track to start administering vaccines on Saturday?
This is Rocky, Everton. Good chatting with you yesterday. As of this morning, we do not have the shipping information. We looked at the system about 15 minutes ago, so it's still pending. We still expect it to come, the next 48 hours or so, and we're still projecting our start date to be Saturday.
Next question will be Laura Cruces from Univision, and that will be followed by Ram Guzman from CBS 11.
Hi, good morning. I don't know if anyone can, say that or respond this in Spanish, but I would like to know how many vaccines in total, both of Pfizer and Moderna, do you expecting? I understand the 50 FAR workers are going to receive it today, but when is going to be the next, group? Today is going to be 50, and then how many?
Again, this is Rocky Vaz again. So we do have an offer from Parkland to vaccinate 50 of our firefighters today, and that should be happening this morning. And then we do have a direct allocation from the State Department of Health of 2,000 vaccines. We are waiting on shipping information and actually receiving that. We are hoping we'll get that in the next 48 to 72 hours. And as I mentioned earlier, we are still targeting to start vaccination on Saturday, the 26th.
Catherine, do you want that in Spanish?
Please, thank you.
Muchas gracias por su pregunta, Laura. Esta mañana, 50 de los bomberos de Dallas, que son paramédicos, están recibiendo la vacuna de Parkland y la ciudad le da gracias a Parkland por su ofrece de vacuna, y en los próximos días 2,000 vacunas de la ciudad de Dallas va a venir, y no estamos exactamente seguros en qué día que va a venir. Es la Navidad, pero ahorita nos plan es para empezar en sábado.
Thank you.
Thank you, Alex. Our next question will be from CBS 11, followed by LP Phillips from KRLD. Ram Guzman, you're off mute if you would like to ask a question. Ram Guzman, if it's easier for you to put your question in the chat, we can read it in a minute. Otherwise, We'll take our next question from LP Phillips, KRLD.
Yeah, you guys hear me okay?
Yes, sir, and you'll be followed by KERA. Go ahead, LP.
Okay.
Thanks.
The introduction of the Moderna vaccine seems to be welcome. It seems to be moving things up here. How does that change the metrics for getting shots to all of our first responders? And when do we actually expect shots to go into the arms of those in nursing homes? How far along do you have to be before that happens? Anyone hear that?
I'm sorry, this is Rocky. I got kicked out. I had to dial back in. Can you repeat your question, please?
Oh man, we were just talking about your job getting terminated. You didn't hear that? Okay. No, Rocky, what I was saying was the Moderna vaccine, how does that change the metrics for your schedule? And the second part of that, if you didn't hear it, was nursing home, or not nursing homes, but assisted care living. When can we, realistically, does this move up when we might see shots for nursing homes?
So I can speak to what the city of Dallas is doing. So I think the first part question was Moderna. Yes, we're getting those 2,000 vaccines, and those are 4 weeks apart, which we again hope to start the process on Saturday. As far as the nursing homes and long care facilities, that's something the Dallas County Health Human Services is handling, and or the state that and the feds that have direct contracts with CVS and Walgreens. We do not have any more information than what we all hear as to when that is coming. I do not have any indication of to when they would start long-term or nursing home facilities, unless Dr. Eastman or Dr. Isaacs has any more additional information.
No, I would defer you to the state and our Dallas County Health Department partners who have more information outside of our city paramedics, firefighters, and police officers.
Thank you, Dr. Isaacson.
I could ask one more question if I could as a follow-up.
Can we go one more round with every, can we give every reporter first round before you get a second round, please, LP?
Sure.
Okay, thank you. Next will be KERA, Hadi.
Hey gang, this is Hadi Mawagdi from KERA here, and I got a pretty basic question for you. How did these extra vaccine shots get to Dallas Fire and Rescue? I think that's what people are going to be more excited about today, that frontline workers are getting them. They've been putting themselves at risk as well, and we want to know how it got there. What's the story behind that? Logistics, I guess.
Well, I'd be happy to take this if that's okay with everybody. So, as you know, our paramedics, firefighters, and police officers every day demonstrate their commitment, dedication, and bravery on the streets of Dallas. And never has that been more true than during this pandemic, when they help take care of the people of Dallas each and every day, sometimes at personal risk to themselves, their own health, and the health of their colleagues and families. So we are very excited to have the support of the city leadership, the chiefs, and our partners at Dallas County, and of course the state, in making vaccine available to the city so that we can take care of those that take care of us. And we're grateful that we are following right behind our healthcare workers, hospitals, and clinics, and making sure that those that care for the people of Dallas are protected. Or, as you know, in a war like COVID, we have to protect the warriors. And we're grateful for the opportunity to receive vaccine and to begin vaccinating our first responders.
Rocky, you're off mute. I don't know if you wanted to add to that or if the other representatives of Dallas Fire Rescue and Dallas Police Department just wanted to speak to the importance of this day.
again, not the importance for us. We're still curious on like how it got there. I mean, like, were there just 50 extra vaccines? Because I mean, I did the story about them going to Parkland, and they had all these people ready to take these vaccines, and now there's just 50 more of them. So how did that happen?
So I don't want to speak for Parkland. We're just very grateful. We have a long-standing relationship with Parkland, UT Southwestern, and our other healthcare hospital partners in Dallas. And Parkland said that they had doses they wanted to make available to our paramedics. And we said, thank you. As far as the state goes, they have a process where we can apply to take care of our most at-risk city workers. And through the leadership of Director Vaz and his staff and the chiefs, we applied to the state. And we learned last week that we were approved and will be receiving this initial shipment of what we hope will be 2,000 doses.
Thanks, Marshall.
Okay, that does it for our first round of questions, unless Vince Johnson wanted to identify his outlet and join. Otherwise, we'll go back. Before I go through everyone for a round two, Chief Artis and Chief Stidham, did either of you want to add anything to what's already been shared or speak about what this day means for your departments?
Sure. Thank you, Catherine. This is Chief Artis. I'm so thankful that Parkland did allow us to have 50 of our first responders vaccinated. We're thankful for that effort, as well as the partnership that we share with Parkland. As we move forward in the process of getting our team vaccinated, this is very important, not only for the morale of our department, but to also let our first responders know that we are looking out for their safety as well as their family safety. And so I'm excited and to be a part of putting this operation forward for our department and our city. And can't wait till we get our first shipment in so we can begin the process of vaccinating our first responders.
Catherine, can I give you something on behalf of Interim Chief Anderson?
Please do.
Yeah, so again, I think on behalf of Interim Chief Lonzo Anderson and the men and women of the Dallas Police Department, it is really what Chief Artis just said. It really hits it home for me. This vaccine is here earlier than we honestly expected. We're glad to have it. We appreciate the partnership from Parkland. As many of you know, I used to be the chief of trauma surgery there, and still very much part of the family. This city's public safety community, when we have seen incredibly tough times, we've always come together as one family. Police, fire, EMS, and the city's trauma centers and hospitals. And today's no exception to that. And so those 50 doses will go to our frontline paramedics, which will help us give doses to the rest of Tier 1A and 1B in our organizations. And we're thrilled. I think the only way, and I know Chief Anderson would agree, the only way we get through this is by all of us rolling up our sleeves and doing our part. And so I'm proud to say that I have, and Marshall has, and as frontline healthcare workers, and we hope that all of our public safety professionals in the city do the same.
Many thanks. And now we'll go to our second round of questions, restarting with Dallas Morning News' Everton Bailey, to be followed by Ram from CBS 11.
Hey, everyone. Thanks again. So I have a bit of a two-part question. Roughly, how many police and fire staff have contracted COVID-19 since March? And are there any concerns from the chiefs and the medical directors that staff members may be opting out of taking the vaccines when they're made available?
Hi, this is Chief Artis. I can speak for Dallas Fire Rescue. Currently, we've had 367 of our members to test positive for COVID-19. And of that, 292 have returned to work. Right now, we have 75 that are out that are positive with COVID-19, as well as a few others for a total of 113 that are quarantined, including that 75. And so, as you can see, this is definitely affecting our department. That's why we're so anxious and excited about getting the vaccine for our teams. Now, the second part of your question about folks opting out of the vaccine, well, we're trying to do a media campaign inside of our department that Dr. Isaacs, as well as myself and the command staff, Chief Stidham, we're trying to show our team that the importance of getting the vaccine, and hopefully that number is very, very small in our department that won't take the vaccine, or I'm hoping for no one opting out. But what we're trying to do is make sure we give them the right information so they can make an informed decision about their safety as well as their health and the safety for their families. And so that's that's the way we're trying to look at it. Dr. Isaacs may be able to share a little bit more from the perspective of how the vaccine works and all that. But what we're doing is trying to make sure that we give them enough information so they can make an informed decision about getting the vaccines.
Chief, well said. I think it's important to remember that it's only in the last few weeks that we've begun to educate the public, much less our first responders, about how safe and effective we believe these vaccines are. And so we're beginning that educational push within both Dallas Fire Rescue, Dr. Eastman, and the chiefs at DPD and our city marshal. After all, a vaccine is only as good as vaccination, meaning we need our first responders, we need the public to have confidence in this vaccine, confidence in the science, that it's safe and effective. For if it's only through people receiving the vaccine that the community as a whole can become protected and we can put this pandemic behind us.
From the police department's perspective, we've had 418 employees contract COVID so far. That's 364 sworn officers and 54 civilians as of last Thursday's update. And obviously, you know, one very high profile, unfortunate member of the department, longtime member of the department who passed away from COVID. I think the message to all of my brothers and sisters in the police and fire departments out there is that, you know, the way through this is by getting vaccinated. And we really need everyone to do their part. You know, the U.S. Surgeon General has coined the phrase sleeve up for vaccines. So it is time for every police officer and firefighter in the city to sleeve up and get this vaccine. It's the only way and our best hope for a return to normalcy in the coming weeks and months.
Next question from Ram with CBS 11, followed by LP at KRLD. Karen, can you take Ram off mute? Oh, we lost Ram. Okay. Well then, LP, you're our next question.
Okay, and I'm not sure, this is for both DFR and Dallas Police. First one at DFR though, it sounds like, if I understood right, paramedics are going to be getting the first round of shots here. Will those paramedics who have the shots be kind of moved up the response ladder, if you will? In other words, when you need somebody to go out, are they one of the first you're going to send out because they've had at least one round of shots? And the second one is I'll throw that out for whoever wants to answer. How long before you think everyone that is a first responder for either DFR or for Dallas Police will get a shot?
All right. First of all, I'll take part of it, and then I'll pass it over to our incident commander, Chief Stidham, who is over our Operation Medicine Wheel. That's the name of what we're calling this plan to vaccinate all of our first responders. What we're planning to is to, of course, vaccinate our paramedics first, but that doesn't call for us to not send anybody out. We still have to take all the proper precautions that we would on any call, because not only does our paramedics go out on the paramedic rig, but they also go out on our fire trucks. And so It's not that we will change our response in any way. We just want to make sure that they continue to take the proper precautions to keep themselves safe from COVID-19. And then I'll let Chief Stidham kind of talk about the operation of Operation Medicine Wheel.
Yes, sir. Good morning. So the way it's going to work is we're looking at starting on Saturday, like was mentioned earlier, and we're looking at vaccinating up to 250 DPD, DFR, and Dallas City Marshals a day for the first few days, and we may be able to ramp that up. I think we will after a few days after we kind of see how things are going, but that's our plan initially. So looking at if we get everybody to get on board and get the vaccines, which, you know, the two doctors spoke very well to, which we really want that to happen. We're looking at probably about 20 days or so to get through all of our folks. And this Moderna vaccine, you have to have the second shot at 28 days. So that gives us a little time to kind of recover, recoup a little bit, revamp the plan if necessary, and get ready for round two. So we've got a very good plan in place. We have an excellent management team made up of both DFR, DPD, and Office of Emergency Management, and medical doctors here that are on the line. And so we're going to be ready to go as soon as we get those vaccines.
And this Rocky, I just want to add one thing. While we have been told that we're getting the 2,000 vaccines in round one, we don't know what next week looks like. We don't have an allocation. So it's all dependent on what allocation we get or how many vaccines we get that we will be able to vaccinate all our 5,000 first responders. I just want to be out there so we do not have a clear path without knowing what we're getting from the state.
And Rocky, Dr. Eastman and I want to point out a reminder that while this is an incredibly positive step for our first responders, for the city, and for the community in general, this is just a first step. This is going to take some time to get everybody vaccinated, and until there is widespread immunity within the community. And until then, our paramedics, our firefighters, our police officers need to remain vigilant. And that means continuing to use masking, maintaining physical distancing and hand hygiene, and all the other steps that we've been taking over the past 10 months to prevent exposure to the virus. That is still our best defense until there's widespread immunity.
Laura Cruces, I want to apologize because you had dropped out and I see that you are back. So I didn't want you to lose your place in the line if you have an additional question to ask.
Yes, I lost like a lot of the meeting, so I don't know if you already answered this question, but I would like to know, how do you plan to keep track of the second dose? I know it is 21 or 28 days, depends on the vaccine, but how do you plan to keep track in every worker?
I can answer that. So we've got a tracking system that we're working on through our management team to be able to track every single person. So as they come through, we're going to be giving them the first dose vaccine, and we'll be also setting up a second dose 28 days later based on the Moderna guidelines.
I'm going to translate for Chief Stidham. Laura, tenemos un sistema de controlar y nos vamos usando este sistema para mantener un calendario por cada persona que tiene la vacuna, y después, cuando es la hora para su segunda inyección, el sistema va a comunicar con la persona.
Gracias. No sé si pudiera, de una vez, ya que lo está haciendo en español, sobre el proceso de vacunación que comienza el fin de semana. Sé que empiezan este sábado, van a comenzar a hacerlo 250 al día, según entendí. No sé si puede retomar eso en español, se lo agradecería.
Slow down and tell me what you want me to say again. Yeah.
It's about the vaccine plan. You plan to start this Saturday with like 60 workers per day.
Yeah,
so if you can say that in Spanish, I will like to. I mean, I will appreciate it.
If I can get this phone to stop ringing, I will. You bet. Sorry. I
I'm
apologize.
sorry. I know that I talk very fast.
No, that's okay. It's no problem. Sí, la ciudad de Dallas tenemos un plan para, aquí en la ciudad tenemos un plan para empezar la vacunación, para dar vacuna a toda la gente de seguridad pública, safety, y nos vamos a empezar en sábado y después por los próximos 20 días nos vamos a dar inyecciones más o menos y después para repetir todas estas cosas por el segundo inyección más o menos en un mes, en 28 días.
250 al día.
Sí, sí, sí.
Thank you so much.
Last question to Hadi Moagde with KERA.
Hey, this question can go to either Mr. Artist or Mr. Eastman. You know, you guys talked about nearly 800 workers who've come into contact with COVID and have gotten sick. And Mr. Eastman, you specifically talked about a beloved officer who passed away. And, you know, as everyone keeps saying, this is just the first step towards the end. This is the beginning of the end. And I'm wondering for you guys personally, on a personal level, what does it feel like to get this vaccine? Do you feel like you're able to put people out there a little more securely and that this will be a good thing? Because police and fire, man, those are personal jobs. You get in people's faces.
Chief, you want to take that first?
Sure. First of all, I'd say the men and women of both Dallas Fire Rescue as well as Dallas Police Department, every day they come to work and they serve the citizens of Dallas. And so with us having this vaccine, it's number one, a morale booster for both our departments, as well as it helps to also keep them safe. As we know, we've learned a lot about the COVID-19 over the last couple of months, and it's hit both of our departments very, very hard. And so having this as a tool to not only keep our first responders safe, but also give them the ability to continue to provide the awesome service that they do, I feel that's world class to this city. This is important, not only for us, but also this city. And so as I can say from our first responder community, I'm just excited that we can take a step in trying to mitigate this particular virus and hopefully get the community to join us in those efforts. And so I'm excited that this is a step, and it's only one of the tools to help us to continue to provide that excellent service that we strive for here for the city of Dallas.
Yeah, I would say I've spoken to literally hundreds of police officers during the course of the pandemic. I've spoken to officers who have been sick and worried. I've spoken to officers in the hospital. I've spoken to officers whose families have had COVID-related problems. But the one thing I haven't heard is an officer tell me that they're not going to come to work and they're not going to do everything they can to protect this great city. And so from my standpoint, receiving the vaccine was emotional because it has got the ability to bring closure to a disease that has affected so many people across this city and across our nation and the world. And so this is the next step, and you know, certainly the beginnings of seeing the light at the end of the tunnel. I want to make sure I echo what Marshall said, which is that, you know, just because vaccine is going to be going into arms this week, we really can't let our guard down yet. We've got to continue to do everything we do, you know, and everything we've preached all the way along to wear your mask, wash your hands, and watch your distance. The end is in sight, but we're not there yet.
Speaking personally, this immunization, this shot, for me and for many frontline healthcare workers in hospitals around Dallas, around the country, has not only contained what we believe will be immunity to COVID-19, but this is also a shot of hope. And that was sorely needed right now. And I hope our firefighters, our paramedics, and our police officers will see it similarly. It's a shot of hope.
Thank you, guys.
Laura's asked that I say the same thing in Spanish. Este vacuna es una cosa muy personal por mí y por mis compañeros en los departamentos de policía y de los bomberos de Dallas, porque hablo con mucha gente de los dos departamentos durante este pandemic y personas que tienen COVID y que tiene familia que tiene COVID, cada día está viniendo al trabajo para proteger esta ciudad. Y esta vacuna es un luz en la distancia para regresar de la vida normal.
Thank you, Alex. Thank you all for being here today. Those of you who RSVP'd, we will share when we have available photos and B-roll from our partners at Parkland of our Dallas Fire Rescue workers receiving the Pfizer vaccine today. And this press conference will be available later this afternoon on demand for viewing at the city's YouTube channel, youtube.com/City of Dallas City Hall. Thank you all for your time. Stay safe and healthy and have safe, healthy, happy holidays.
Thank you, Catherine.
Thank you.
Thanks.
Thank you, Catherine.
Thank you, Captain.